And thank you for joining us. With us is Lisa Cox, Outreach and Enrollment Coordinator here at Meadville Medical Center. Lisa, thanks for joining us.
Thank you for having me.
A real pleasure.
Thank you.
We're going to talk about Pennie, and there's a lot to it. But before we get into all of that, tell us a little bit about yourself.
Sure. Let's see. So I've worked here at Meadville Medical for 9 years. I love my job. Legitly, it's so rewarding. I have 2 children and 5 grandkids.
Keep you busy.
Yes, it does. Yes, it does.
When you started at Meadville Medical Center, where did you start?
Actually, this is what I've done right from the get-go, working with the health insurance. Yeah.
Nothing has changed over the years in that department.
Oh, it just stays the same. So many changes, and you got to keep up with it. I mean, you definitely keep up, but good changes. I've seen definitely promising changes. We switched over from the marketplace to Pennie, which is our state base, and it's just gotten better. It's amazing what it can do to help families out with the tax credits and so forth.
Well, let's talk about that, because I think when it comes to healthcare, there's so much confusion. There's so much out there, right?
Oh my goodness, yes.
You have employer side of things. You have individual side of things. You have people thinking, okay, is this a national thing? Is there a state part of this? Kind of break it all down for us.
Yeah, well, so Pennie is what you had said. It's our state-based exchange. And when we switched over to that actually helped us to be able to give the consumers a better discount, if you want to say, which is called tax credits, to help lower their premiums. And the tax credits are decided on your household income and household size. And honestly, everybody pretty much qualifies for the tax credits. So that's a little bit about when we went to state base. I mean, we did have tax credits before, but it's even a better program now that we're run through Pennie.
Now, is Pennie set up for individuals, families who aren't insured, or if a spouse is getting insurance through work, how does that play a role in all of this? Yeah,
so lots of times employers do offer the health insurance, and if you do have health insurance through your work, we are not able to get you into Pennie unless it's considered not minimal standard value. And there's an equation that you figure that out to see if you're paying too much, then we could get you onto Pennie. Or lots of times the jobs will not cover their spouses or their children, so then they definitely qualify for Pennie. A lot of people self-employed. This works really well for them. You want to retire early. This is huge. So many people, this is why I say this job's so rewarding too, want to retire early, and lots of times they think they can't because of the price of health insurance. And I usually, every person that comes in has walked out and they're so pleased and relieved as to, and they're good plans. They're really good plans. But with the rates that they're able to receive by getting the tax credits, it's affordable.
Are these plans that once somebody comes in and sits down with you, they're locked in for X amount of time, or are they coming in to see you every year? How does that work? Yeah,
so we have open enrollment, and that's November 1st to December 15th well, I like to enroll them in that time because then the new plan would take effect January 1st. But new open enrollment actually goes from 11/1 to January 15th. After December 15th to January 15th, then your new plan will take effect on February 1st. But that's most generally, then that's when you can go ahead and change your plan, and you want to, because usually your income's going to change within the year, goes up, goes down. Plans may change. Maybe your doctor is different. When I enroll people, we always double check. As your doctor's accepted on this plan? Does your medications, does it work with this plan? The hospitals that you use. So it's, we just make sure that it covers on all ends. And, throughout the years you may have changes, and so we always want to be sure that's still the good plan for you, the best plan.
You mentioned the enrollment period. Outside of that, if somebody is shopping or looking or considering, is this a good time to sit down with you and have that conversation of what needs to happen?
Absolutely, yeah, definitely. At any time. And then there is a special enrollment also. So you might have lost your job, you've moved, had a baby, newly married, newly divorced, any of that qualifies you. However, when you do that, so you lose for example, you lose your job insurance. This is the same with everything. You have a window of 60 days to get enrolled into the insurance, so you can do that. But yeah, I have people all the time. They're getting their ducks in a row. Hey, I want to retire, or this, I'm gonna start my own business, and they just want to see what's out there. I'm always happy to go through.
Now, going back to maybe somebody who is being offered insurance at work, can they also sit down and discuss that, or are they not allowed if they're being offered insurance through their work?
Yeah, no, give me a call, because there is a chance that what you are paying is not considered affordable, and like I said, there's a ratio, and I could figure that out. And if you are paying, so if you're paying $600 at work, and I figure out the ratio, whether if that is considered affordable for you or not, and it comes up to you should only be paying affordably $500 a month, then I can get you into Pennie.
So there's really a lot of options and a lot of things to go over and consider.
There's a lot. And then also too, when I do the applications, you may qualify for Medicaid, so that will send the consumer rate onto Medicaid. And then also all children qualify for CHIP. And CHIP, they'll either get it free or at a low rate. And so at any time, I should say, all children would qualify for CHIP up to 19.
Do you come across situations where you think, oh my gosh, they should have come to see me, I can help them?
I have.
And whether it's family or individual?
Yeah, absolutely. I'm kind of like the, oh my gosh, I can't think of her name, from Progressive. I mean, I've
Flo.
I've even been in a grocery store, and I was walking by and I heard somebody saying, she just can't get insurance. It's just not affordable for her. And my husband said, keep walking. I didn't. I turned around and I gave her my card, and she called me. This was in Erie, and I got her into Medicaid. So this woman, though, thought that there wasn't options, and there was. I mean, I have situations like that all the time.
You see marketing's developing the ad campaign right now for you?
I do. I like that. Oh, they do so much for me. They're amazing. They are.
Well, obviously this is very important.
It's so important.
And going back to something that you mentioned, people that might be looking to start a business. Mm-hmm. I remember when I started mine, that was a concern at first. Who's going to insure you? Where do you go for that?
Exactly.
So there's a lot of questions that come into play in that situation.
Yeah, and so when that happens too, I always stress to them, now remember, and even as you've had a business for some time, there is always going to be expenses. So, let's kind of, because it's all projected, especially starting out new, and then I'll say, do you have a tax consultant or, somebody to go over to, just to kind of get you close to what you think you might make. But yeah, when you are starting a business, there's always going to be a lot of expenses. So that's going to give you a much lower rate, because your income's most generally going to be lower, right? Yeah, it definitely is very, very beneficial for owners too, business owners or farmers.
I was just thinking about that today. It's interesting here in Northwest Pennsylvania. You probably see a little bit of everything. People, who live in the city, outside of the city, on farms,
right?
Amish communities. It's really a variety of folks that come into play, and when you're the hospital, you're trying to take care of everybody.
And that's a big part of my job. Is partially grant paid also. And I am, our communities, there's a lot of people that, believe it or not, still might not have the internet, or we just don't understand the insurance. And by me coming in and I'm a hand holder and I'm walking them through, helping them, like I said, find the doctor, be sure their doctor has accepted their medication, and find the right plan for them. It's such a relief for them. One, the unknown, I want to explain it to them so they understand co-insurance, out-of-pocket max, and then just be sure it's the right plan. And
is it a stretch to say it's almost like buying a car? You could go online,
yes,
right to the marketplace,
right,
and try to do it yourself, and you might be able to. But by sitting down with a professional, you're going to have somebody you can say, hey, what's this thing? Or do I need this?
Absolutely.
Or should I select this?
Absolutely. And I tell everyone that there is no silly question. Please call and ask me. And if I wouldn't know it, I will find the answer for you. But there's no silly question. Please ask if you're not sure.
What's the process like? If somebody comes in and sits down with you, how much time should they budget to be with you?
Probably an hour, a good hour.
So, I mean, it's pretty in-depth.
Yeah, I mean, so the application I feel is pretty easy, but going through the process first of going through the plans and selecting what works best for them. But, we're going to need it's everybody that is on your income taxes is who you can claim.
Okay.
So we want everybody's social security number, date of birth, and your projected household income. And then that's how that determines your tax credits and your rate. And the plan you select too, there's all different levels. There's a bronze plan that's catastrophic, the gold plan, most people seem to be going that. And the other thing we have is a lot of plans that have zero deductible, which is great.
Wow.
Because everybody has a decent sized deductible anymore. Mm-hmm. And we have this, the one insurer that it's a zero deductible plan, and it's so nice. And most people seem to want to go with that one.
Are these sort of tailored to maybe health situations that are affecting a particular individual or family? If somebody has diabetes in their family, maybe a certain plan is better for them, or if somebody has a history of heart conditions, maybe a different plan is a way to go.
Absolutely, and I asked that too, and they're not uncomfortable. It's very private. It's just one-on-one or one in the family, or however that is. But how is your health? Are you having a lot of tests? Are you diabetic? Are you, and that's questions I ask too, because that definitely helps when we're looking for the plan that fits them best.
And then when you're retired, the cost of prescription drugs comes into play and all of that. So there's opportunity to kind of work to see which plans might cover the drugs that you might be spending a lot of money on.
And that's great. They do. And so a couple of the plans I know, most of them, if they're generics, $0, zero copay. For preferred brands, $30. I mean, so they're good rates. But we go in and I have them give me a list of their medications, and then we pull them up to see, so they know what it's going to be. Are they paying zero copay? Are they paying $30? So they're aware. I want to be sure that all bases are covered before they finish that enrollment.
How often should somebody come in and visit with you in that realm? Is it once a year they should come in and just double check to make sure their plan is still good? Or
definitely, okay. Yeah, especially open enrollment. I always tell everybody, because Pennie will send and say, hey, we just went ahead and re-enrolled you. And I always tell everybody, first off, once I get them enrolled, they're on my dashboard. So then the next time they come in, all of their information is pre-populated. All we're going to do is go through, is this still your address, so on and so forth, and then we'll get to your income. Like I said, usually income changes, but plans may change too, or your health. Mm-hmm. So I always tell everybody, just give me a call. Don't let it roll over. Let's just see if this is still the right plan, and maybe there's even a better plan.
So somebody who's sat down with you, you have them scheduled every year, but somebody who might be thinking about this for the first time, mm-hmm. prior to that November start date when the enrollment period opens, maybe they should have that conversation with you just to kind of get some information?
Oh yeah, definitely. And I do get that a lot. Everybody always calls it getting their ducks in a row. And I said, absolutely. I mean, you need to know. It's so important. And I've had, people that have gotten cancer. And then, you don't think about it, but then you're not working, and then eventually your employer just can't keep your insurance going for you. And this is where it works so well here with the hospital too. So then Yolanda Barco would call me and say, hey, we have, this person, can you help them? Behavior health, they call me a lot. The doctors, I'm trying, really putting it out there. I want everybody to know, send them my way. And if there's something I can't help them with, I have a lot of resources too. So, at that time, if there's not something we have financial assistance programs, or we have other things that people might not be aware of that I can help direct them.
I don't think sometimes people realize too, there's a lot of people on fixed income. So if you can get somebody into a plan and they can save $5 on prescription drugs or whatever the case, that's a big deal to a family or an individual who's on a fixed income.
Definitely, and I see it. I've been called angel, lifesaver, and I almost feel guilty because it's my job, but it is. It's so rewarding because of that. It's just it really does save and makes it affordable for people that thought it wasn't going to be.
And this is why you enjoy coming to work every day.
I literally do. I really do.
What do you do at the end of the day to unwind and relax? What do you enjoy doing?
Well, it's grandkids. We're always with the grandkids. There's soccer, there's baseball, there's dance, and then of course I love spending time with my husband. So yeah, definitely family and friends and grandkids.
We were talking prior to the start of the interview. You grew up in this area.
I did.
What made you decide to stay here? Like, this is the place I want to live?
Yeah, definitely. It's family, definitely family, and the school I went to, my kids went to the school there. It's just a great place to raise your family, and since I've been working at the hospital too, what a group of resources we have. I mean, everybody in this area works so well with each other, and like I said, if I can't help you with something, I can send you somewhere else, and they do the same. It's a really nice community to raise your family and to live in.
I was thinking just recently, it would be so easy for this organization to say, we're just going to offer X, Y, Z, and somebody else can handle the rest.
Right.
But there's that commitment to reinvesting in technology, the people.
Right.
It's such a great place. We are so fortunate to have this facility.
We really are. And this is Meadville Medical that's wanting, to have my position here as a sister, because they're here for the community too. And by getting them insured, they can have their health taken care of and affordably.
That's wonderful.
Yeah, it is.
Well, Lisa, how does somebody begin the process? Do they call your office directly? Do they talk to somebody else?
They call me. My number is, do you want my number?
Sure.
All right. It's 814-333-1758. Believe it or not, a lot of people, especially since COVID, they like to be enrolled over the phone.
Oh.
And so, I mean, they come to my office too, but when we do that, then we really go in depth, which we do either way, over, what plan fits the best. I email them, and we'll do it that way, or you come to my office, and I'm always happy to help.
Or if you see her at the store or out and about.
Yeah, don't be talking insurance, because I'm listening.
Lisa Cox with us. Lisa, thanks for your time.
Yeah, thank you.
Great pleasure.
I appreciate it.
And thank you for joining us as well.